We already know for quite a while that our genetic background influences how we respond to drugs. And now that more and more information is gathered, we also have specific recommendations on how to use it for specific drugs. And so there really is enough opportunity to introduce it into clinical practice. And obviously pharmacists as experts of pharmacotherapies are really a relevant asset in bringing this to clinical practice. Yeah. In our presentation, the main point I think is, well, genetics, they can influence drug response. However, this is a multifactorial picture as always in life. So we need to consider also that and cannot just in isolation assess drug-gene interactions. So there really also is, this is the perfect field for pharmacists to be involved actually. Yeah. So we've done now a lot of pharmacogenetic testing in clinical practice with pharmacists, and we really found that this is not always really a straightforward thing. So there are a lot of things that need to be considered, and as I talked about, different factors influencing also the genetic background. But however, at the moment, all these factors combined, it still is difficult to assess the overall impact. So yeah, that certainly depends on the laboratory you're working with. So in our case, these were turnaround times of around a week. And then this, as you already are mentioning, this is it is labor intense for the pharmacist to put all this information together in the end. And that's also one of the barriers that we see for implementation in clinical practice, because at least in Switzerland, such a service would not be fully covered by basic health insurance. Well, I don't know in detail the situation in Portugal, but the project I was showing you, that certainly was part of research also. So we're also still working on this. So that's not the normal situation. So not every patient in Switzerland gets pharmacogenetic testing. That's still not the case. So that's there still is a lot of work going on there. Yeah.